I want you to do something right now before you do anything else. Stand up if you can close your eyes for just 3 seconds and notice what your body does. Do you sway? Do you feel the need to reach for something, anything to steady yourself? Most people who watch this video already know the answer before they even try it because they have been living with that unsteady feeling for months, sometimes years. It is not dramatic most days. It is not a dizzy spell that sends you to the emergency room. It is quieter than that. It is the small stumble when you turn too quickly. It is grabbing the kitchen counter without even thinking about it anymore. It is the hesitation before you step off a curb, the extra second you take on the stairs, the way you have quietly stopped doing things you used to do without a second thought. Here is what I need you to hear today. Balance is not one single thing. It is not a switch that simply wears out with age the way people assume. Balance is the product of at least 3 separate systems in your body, working together constantly every second you are upright, whether you are aware of it or not. And when one of those systems begins to falter even slightly, your brain has to work harder to compensate using the other 2. That compensation is exhausting, and eventually it starts to fail too. Most people are never told this. They are told vaguely that balance gets worse with age, as if that explains anything at all. It does not. It is a description, not an explanation. And today I'm going to give you the actual explanation because I believe you deserve to understand your own body, rather than simply accept a vague dismissal from a rushed appointment. My name is Dr. Michael Carter. I work in preventive health and senior wellness, and my approach here has always been the same. Plain language, real research, and practical steps you can start using tonight. Balance problems are one of the most under-investigated issues in adults over 55, and I want to explain exactly why that is, because the reason is almost as important as the causes themselves. Most primary care visits are 15 minutes long. In that time, a doctor has to review medications, check vital signs, address whatever the primary complaint is, and move on to the next patient. Balance testing. Real balance testing takes time. It requires specific maneuvers, specific questions, sometimes referral to a specialist. It is simply not something that fits into a rushed visit, and so it gets waved away with reassurance instead of investigation. That is not a criticism of any individual doctor. It is a structural problem in how healthcare visits are designed, and it means the responsibility often falls on you to notice the pattern and advocate for yourself. Before we go further, I want to know something from you. Drop a comment below and tell me this. Does your unsteadiness happen more when you stand up quickly, or does it happen randomly throughout the day, regardless of what you are doing? Write standing up or random in the comments. I read every single one, and your answer actually narrows down which of today's causes is most likely playing the biggest role in your body specifically. Now let me walk you through the foundational piece of biology that almost nobody explains properly, because once you understand this, the 5 causes I am about to cover will make complete sense. Your balance depends on 3 input systems, sending information to your brain constantly. The first is your vestibular system, a set of fluid-filled structures in your inner ear that detect motion and the position of your head in space. The second is your vision, which gives your brain a constant visual reference point for where you are relative to the world around you. The third is proprioception, a term for the sense receptors in your muscles, joints, and the soles of your feet that tell your brain exactly where your limbs are and how much pressure is under your feet at any given moment. Here is the critical detail. Your brain takes information from all 3 of these systems simultaneously and blends it into a single continuous sense of balance. When you were younger, all 3 systems were operating at full strength, and even if one gave slightly imperfect information, the other 2 compensated instantly and you never noticed. But research has confirmed clearly that each of these 3 systems can decline gradually, with age often at different rates, often without any single dramatic symptom. And when more than one system weakens at the same time, which happens far more often than people realize, the compensation your brain used to rely on stops working as well. That is the moment unsteadiness stops being occasional and starts becoming a daily companion. This matters enormously because it explains why balance problems are so often dismissed or misdiagnosed. A doctor checks your vision and it is fine. They check your inner ear briefly and nothing obvious jumps out. So you are told everything looks normal, and you are sent home no closer to an answer, even though the real issue may be a combination of smaller declines across multiple systems that no single test was designed to catch. Today, I am going to walk you through 5 specific research-supported causes of persistent balance problems in adults over 55. And just like we do in this channel, I am going to tell you which of these causes most commonly overlap and compound each other, because understanding that overlap is often the missing piece that finally makes sense of what your body has been doing. The first cause is one that I want you to pay very close attention to, because it is, according to the research, one of the single most common and most overlooked contributors to balance problems in this age group. It is called benign paroxysmal positional vertigo, often shortened to BPPV. I know that sounds intimidating, so let me explain it in the simplest terms possible. Deep inside your inner ear, there are tiny calcium carbonate crystals, sometimes called otoconia, that normally sit in a specific structure and help your brain detect gravity and linear movement. As we age, these crystals can become dislodged from their normal position and drift into one of the fluid-filled canals responsible for detecting rotational movement. When that happens, anytime you move your head in certain directions, tilting it back to look at a high shelf, rolling over in bed, bending down to tie your shoes, those displaced crystals shift inside the fluid and send your brain a signal that you are spinning even though you are completely still. Your brain, trusting that signal, produces a brief, often intense sensation of vertigo, sometimes lasting only seconds, sometimes longer. Research consistently shows that BPPV becomes dramatically more common with age, and that a large proportion of people living with it have never been formally diagnosed because the episodes are brief and people assume they simply got dizzy for no particular reason. Here is the detail that makes this condition so frequently missed. The dizziness from BPPV is triggered specifically by head position changes and tends to resolve within less than a minute. Because it passes quickly, most people never mention it to their doctor, or if they do, the description is vague enough that it does not prompt further investigation. But here is what is important. BPPV is one of the most treatable causes of balance problems that exists. There are specific repositioning maneuvers performed by a trained physical therapist or specialist that physically guide those displaced crystals back to where they belong, and many people experience significant improvement after just 1 or 2 sessions. Ask yourself honestly, does your dizziness happen specifically when you tilt your head back, roll over in bed, or bend forward and then stand up quickly? That pattern is the fingerprint of BPPV, and I will talk about what to do with that information in the action plan. Before we continue, take a moment and tell me your name and where you are watching from today. I read through the comments regularly, and I want to know who I am speaking with and supporting through this. The second cause is one that tends to develop so gradually that most people never notice it happening until it has already become significant. This is the decline of proprioception, particularly in the feet and ankles. Remember what we discussed earlier. Proprioception is the sense that tells your brain exactly where your feet are and how much pressure is beneath them moment to moment without you ever consciously thinking about it. This sense relies on nerve endings embedded throughout the soles of your feet and the small stabilizing muscles surrounding your ankles. Research has established clearly that peripheral nerve sensitivity in the feet naturally declines with age, and this process can be significantly accelerated by conditions such as diabetes, even mild or borderline blood sugar elevation, that has not yet been formally diagnosed. When the nerve endings in your feet become less sensitive, your brain receives a weaker, less precise signal about your footing, particularly on uneven surfaces in dim lighting, or on surfaces like grass, gravel, or sand, where the feedback is naturally less consistent than on a flat floor. This is precisely why so many people describe feeling far less steady walking outdoors in the evening compared to walking through a well-lit flat hallway indoors. It is not simply the lighting, it is the compounding effect of reduced visual input and reduced proprioceptive input happening at the same time. A particularly important detail here, one that is rarely discussed, is that this decline is frequently silent in the early stages. You may not notice numbness or tingling. You may simply notice that your balance feels slightly less reliable than it used to without any obvious sensory symptom to point to. This is one of the reasons a simple blood sugar check, even for people who do not consider themselves diabetic, is worth specifically requesting from your doctor if balance has become a persistent issue. Peripheral nerve changes related to blood sugar can begin well before a formal diabetes diagnosis is ever made. If you are finding this helpful so far, type the number 2 in the comments so I know you are still with me. And if you have not subscribed yet, please do. It genuinely helps this channel continue reaching people who need this information. Now, because number 3 is one where I consistently see the most surprise on people's faces when I explain it in consultations, because it involves medications that people have been taking faithfully for years without ever questioning them. Several extremely common medication categories carry a documented side effect of dizziness or unsteadiness, and the connection is frequently never made because the side effect can take weeks or months to become noticeable after a dose change. Blood pressure medications, particularly when a dose is increased, can lower blood pressure slightly too much when you stand up a condition called orthostatic hypotension, causing a brief, lightheaded, unsteady sensation, specifically when transitioning from sitting or lying down to standing. Certain sedatives, sleep medications, and some antidepressants carry documented effects on balance and reaction time, particularly in older adults, where the same dose that was well tolerated at 50 can produce noticeably different effects at 70, simply because the way your body metabolizes these medications changes with age. A large-scale study reviewing falls in older adults found that the number of medications a person takes concurrently is itself an independent risk factor for balance problems separate from what any individual medication does on its own, a phenomenon researchers refer to as polypharmacy risk. This does not mean your medications are wrong for you. It means the specific combination and dosing deserves a periodic review, particularly if your balance changes have coincided with any new prescription or dosage adjustment. If you are still watching, type the word clarity in the comments, because that is exactly what today's conversation is meant to give you. The fourth cause is one that surprises people, not because it is complicated, but because it is something they assumed was simply a normal part of getting older, rather than something with a specific addressable mechanism behind it. This is the loss of muscle strength, specifically in the muscles of the legs, hips, and core, a process researchers call sarcopenia. Here is what makes this different from simply feeling weaker in a general sense. Balance is not maintained passively. It is maintained through constant, tiny automatic muscular corrections, happening every single second you are standing or walking, adjustments so small and so fast that you are never consciously aware of them. Your hip muscles, your ankle muscles, and your core all fire continuously to catch tiny shifts in your weight before they become a stumble. Research has confirmed that muscle mass naturally begins declining as early as your 30s, and that the rate of that decline accelerates significantly after age 60, particularly in people who have become more sedentary. The frustrating part is that this decline can happen even in people who do not consider themselves particularly inactive, because the specific muscles responsible for these rapid balance corrections are not always engaged by ordinary daily activities like walking to the car or doing light housework. What is required is a specific kind of muscular strength and reaction speed that only comes from targeted movement. Here is the detail that most people never hear. This decline is not simply about strength, it is also about reaction speed. Research shows that the neural signal that tells a weakening muscle to fire and correct a balance shift slows down with age, meaning that even when the muscle itself still has some capacity, the message telling it to activate arrives later than it used to. This combination, reduced strength plus delayed activation, is precisely why a small stumble that would have been instantly and unconsciously corrected at age 40 can turn into an actual fall at age 70. The encouraging research here is genuinely encouraging. Multiple clinical studies have demonstrated that targeted strength and balance training programs, even started later in life, can meaningfully improve both muscle strength and reaction speed within a matter of weeks, not years. This is one of the most modifiable causes on today's list, and I will give you a specific practical starting point in the action plan. If this is resonating with you, type number 4 in the comments. And if you have not already subscribed, this is a good moment to do that, because we cover exactly this kind of practical research-backed guidance regularly. The fifth cause is one that rarely gets discussed in videos like this one, and I believe that is a meaningful gap because for a real portion of older adults dealing with persistent balance issues, the root cause is not in the ears, the feet, the medications, or the muscles directly. It is in the eyes, specifically in a category of vision changes that go beyond simply needing a stronger prescription. As we age, the eyes undergo changes not just in sharpness of vision, but in something called contrast sensitivity, the ability to distinguish subtle differences between similar shades, such as a beige step against a beige floor or a curb that blends into the surrounding pavement in low light. Research has confirmed that contrast sensitivity can decline significantly with age, even when standard vision tests, the kind that measure how small a letter you can read on a chart, come back essentially normal. This distinction matters enormously because a standard eye exam is often not designed to catch this specific kind of decline. You can have 20/20 vision on paper and still have meaningfully reduced ability to detect subtle depth changes, particularly in dim lighting or in environments with low contrast between surfaces, precisely the conditions in which many falls occur. Additionally, depth perception itself, which relies on both eyes working together and sending slightly different images that your brain merges into a three-dimensional sense of distance, can decline with age-related changes to eye muscle coordination, sometimes independent of any change in visual sharpness at all. This is compounded further by a very common and often overlooked issue: outdated eyeglass prescriptions, particularly with bifocal or progressive lenses. These lenses are wonderful for reading, but the lower portion of the lens, the part your eyes naturally look through when glancing down at your feet or at stairs, is calibrated for close-up reading distance, not for the middle distance involved in looking at the ground while walking. Research has specifically identified progressive and bifocal lenses as an independent risk factor for falls in older adults, precisely because of this mismatch between what the lens is designed for and how it is actually used while walking. Ask yourself, has your vision changed noticeably in low light or in the evening compared to how it used to be? Have you had a comprehensive eye exam, one that specifically checks contrast sensitivity and depth perception, rather than just sharpness within the last year? These questions matter more than most people realize. Before I move into the action plan, I want to take a moment that is genuinely important. Most balance issues discussed today are common, manageable, and addressable through the steps I am about to walk you through. But some balance changes signal something that requires prompt medical attention rather than home management. Please see your doctor promptly if you notice any of the following: balance changes that came on suddenly rather than gradually. Balance problems accompanied by slurred speech, facial drooping, or weakness on one side of the body. Severe, prolonged vertigo lasting hours rather than seconds. Balance problems accompanied by chest pain or a racing heartbeat. Or any fall that resulted in a head injury. These signs go beyond the scope of today's conversation, and they deserve immediate medical evaluation rather than home strategies. Now let us move into the action plan, because this is the part where everything we have discussed becomes something you can actually put into practice starting today. I want to walk through this step by step, organized by what you can do this evening, this week, and this month, because balance improvement is genuinely one of the more responsive areas of health when it comes to consistent, targeted effort. Tonight, before you go to bed, I want you to do a simple self-check that takes less than 2 minutes and gives you real information about your own body. Stand near a sturdy countertop or the back of a heavy chair, something you can grab instantly if needed, and have someone nearby if at all possible for safety, with your hand hovering near that support, but not touching it. Close your eyes and try to remain steady for 10 seconds. Notice honestly how steady you actually are. Now sit on the edge of your bed, lie down, and slowly roll onto your left side. Pause, then roll onto your right side and notice whether either direction produces any brief spinning sensation. This tells you directly whether the positional pattern we discussed with BPPV might be relevant to you specifically, and it is information worth writing down and bringing to your next doctor's appointment. This week, I want you to request 2 specific things from your doctor that are not typically included in a routine visit unless you ask directly. First request, a fasting blood sugar or hemoglobin A1C test if you have not had one, recently, specifically mentioning that you are asking because of balance concerns and want to rule out early peripheral nerve involvement. Second request, a full medication review specifically focused on balance and dizziness side effects, bringing a written list of every medication and supplement you currently take, including the exact dosages and how long you have been on each one. If you have noticed your balance changes lining up with the timing of any new medication or dosage adjustment, mention that connection explicitly, because that timeline is exactly the kind of detail that helps identify a medication-related cause. Also this week, schedule a comprehensive eye examination if it has been more than a year since your last one, and specifically ask your eye doctor to assess contrast sensitivity and depth perception, not just visual sharpness. If you wear bifocal or progressive lenses, mention specifically that you have noticed balance concerns, particularly on stairs or uneven ground, because your eye doctor may recommend a separate pair of single vision glasses specifically for walking and outdoor activity, distinct from your reading or driving glasses. This month, I want you to begin a specific simple strength and balance routine, because remember, this is one of the most modifiable causes we discussed, and research shows measurable improvement can begin within weeks of consistent practice. Start with what is called single leg stance practice. Standing near a countertop for safety, lift one foot slightly off the ground and hold your balance for as long as comfortably possible, starting with even 5 to 10 seconds if that is where you currently are without judgment. Do this 3 times on each leg, once in the morning and once in the evening. As this becomes easier over the following weeks, you can progress to doing it without holding onto the counter, though always with it nearby for safety. Pair this with heel-to-toe walking practice, walking in a straight line, placing the heel of one foot directly in front of the toes of the other, as if walking along a tightrope again near a wall or countertop for safety in the beginning. This directly trains the same proprioceptive and muscular systems we discussed, and research on structured balance training programs has shown meaningful improvement in fall risk within as little as 6 to 8 weeks of consistent practice several times per week. If you have access to a physical therapist, and I genuinely encourage you to ask your doctor for a referral, a vestibular or balance-focused physical therapist can perform specific diagnostic maneuvers to identify BPPV directly, and in many cases resolve it in a single appointment through a repositioning technique called the Epley maneuver, which involves a series of specific head and body position changes performed by a trained professional. This is not something to attempt on your own from a video, but it is worth specifically requesting by name when you speak with your doctor, because not every provider automatically considers it, and it has a strong evidence base for effectiveness. For your home environment, I want you to walk through your living space this week with fresh eyes, looking specifically for the risk factors we discussed today. Improve lighting in hallways, staircases, and bathrooms, particularly if you have noticed vision changes in low light. Remove or secure loose rugs, particularly at the top and bottom of staircases, where changes in surface height combine with the exact depth perception challenges we discussed. Install grab bars in the shower and near the toilet if you have not already, not as an admission of weakness, but as a practical tool, the same way you would use a handrail on stairs, regardless of how strong your legs are. If you are finding this genuinely useful, type the word action in the comments, because taking that first step tonight is exactly what separates people who see real improvement from people who simply watch and move on. A quick word on some of the popular home remedies and advice you may have already come across, because I want to address a few of these directly with the actual research rather than letting misinformation continue to circulate. Ginger has some evidence supporting mild relief of nausea associated with vertigo episodes, and it is generally safe for most people, but it does nothing to address any of the 5 underlying causes we discussed today, so think of it as comfort rather than treatment. Vitamin B12 supplementation is genuinely worth discussing with your doctor if a blood test confirms you are deficient, since B12 deficiency can independently affect nerve function and contribute to balance problems. But supplementing without a confirmed deficiency has not been shown to meaningfully help balance in people whose B12 levels are already normal. So a blood test before supplementing is the responsible approach, rather than assuming more is automatically better. There is also a popular idea that balance problems are simply inevitable and untreatable. Once they begin, something people are told, often unintentionally by well-meaning family members, or even by rushed medical appointments that do not have time to dig deeper. I want to be direct with you about this. The research we have walked through today does not support that idea at all. Every single cause we discussed: positional crystal displacement, peripheral nerve sensitivity, medication effects, muscle strength and reaction speed, and vision-related depth perception changes, has a specific evidence-supported response available. None of them require simply accepting decline as inevitable. I also want to address something that comes up frequently in the comments on videos like this one, which is fear. Balance problems, once they start, often bring with them a quiet fear of falling, and that fear itself can become part of the problem. Research has actually documented something called fear of falling as an independent contributor to balance issues, because when you become afraid of losing your balance, you tend to move more stiffly, take smaller and more hesitant steps, and reduce your overall activity level, all of which can actually worsen the muscular and proprioceptive decline we discussed earlier, creating a cycle that reinforces itself. This is precisely why the strength and balance practice I described is not just physically beneficial. It can also help rebuild confidence gradually in a controlled and safe way, which itself becomes part of the solution. I want to also mention something specific about outdoor walking, since many people watching this have quietly scaled back walks, errands, or time outdoors because of balance concerns without necessarily connecting that reduction in activity to a worsening of the very problem they are trying to avoid. If you have reduced your activity due to balance fears, I want to gently encourage you to discuss a supervised walking or physical therapy program with your doctor rather than simply avoiding activity altogether, because research consistently shows that appropriately guided activity rather than avoidance is what actually improves long-term balance and reduces fall risk. A cane or walking pole used properly and fitted to your correct height is not a sign of decline. It is a tool the same as reading glasses or a hearing aid, and research shows that properly used mobility aids meaningfully reduce fall risk while allowing people to maintain the activity level that protects their balance systems over the long term. Here is what I want you to walk away with today. Your balance is not one system quietly failing with age in some vague, unexplainable way. It is at least three distinct systems: your inner ear, your vision, and your proprioceptive and muscular network working together continuously. And when we understand which of these systems may be contributing, in your specific case, we can respond with real targeted evidence-based steps rather than simply accepting unsteadiness as an unavoidable part of getting older. The 5 causes we covered today: positional crystal displacement in the inner ear, declining nerve sensitivity in the feet, medication-related side effects, muscle strength and reaction speed, decline and vision-related depth. Perception changes frequently overlap in the same person, which is exactly why balance problems can feel so persistent and confusing. But each one is identifiable, and each one has a specific response available to you starting today. I want to spend a little more time here talking about how these 5 causes tend to interact, because understanding the overlap is often the piece that finally makes sense of what your body has been experiencing, and it is rarely discussed clearly anywhere else. In my experience, the 2 causes that most frequently occur together are declining proprioception in the feet and muscle strength decline in the legs and core, and the reason makes complete sense once you think it through. When the nerve signal from your feet becomes less precise, your brain has to rely more heavily on quick muscular corrections to catch small balance shifts that your feet no longer detect as clearly. But if your leg and core muscles have also weakened and their reaction speed has also slowed, that backup system is compromised at exactly the moment you need it most. This is why so many people describe a specific kind of unsteadiness that feels like it came on gradually and then seemed to accelerate rather than appearing suddenly, because 2 systems were quietly declining together, each one able to compensate for the other only up to a point. Vision changes frequently compound with both of these. When contrast sensitivity or depth perception declines, your brain leans more heavily on input from your feet and inner ear to fill the gap, precisely the systems that may already be under strain. This is exactly why balance problems are so often described as worse in dim lighting on unfamiliar or uneven surfaces, or later in the evening, because these are the exact conditions where your visual system, already weakened, is least able to compensate for the other declining systems. Medications add a separate layer on top of all of this, because unlike the other 4 causes, which tend to develop slowly, a medication or dosage change can suddenly tip a person who was successfully compensating for mild declines in the other systems into a noticeable balance problem almost overnight. This is precisely why the timeline you bring to your doctor matters so much. If your balance changes coincided with a new prescription or a dosage increase, that connection deserves specific attention rather than being dismissed as coincidence. I want to return to something I mentioned earlier because I think it deserves repeating with real emphasis. The compensation your brain performs to blend information from your inner ear, your eyes, and your proprioceptive system is not something that happens with effort you can feel. It happens automatically, constantly beneath your conscious awareness. This is exactly why balance decline can feel so confusing and frustrating. You are not doing anything differently. You have not become careless or clumsy. Your brain has simply lost some of the raw material it used to rely on, and it is doing its best with less information than it used to have. Understanding this distinction, that this is a physiological change rather than a personal failing, matters because I have spoken with so many people who have quietly internalized their balance problems as a sign of personal decline, when in reality, it is a specific, identifiable, and largely addressable set of physiological changes. I also want to speak directly to something that comes up often from family members watching videos like this on behalf of a parent or older relative. If you are watching this because you are concerned about someone you love, the most useful thing you can do is not to simply tell them to be more careful, which research shows is rarely effective and can feel dismissive to the person experiencing it. Instead, offer to accompany them to a doctor's appointment specifically focused on balance. Help them write down the timeline of when symptoms started relative to medication changes, and consider doing the strength and balance exercises together, since accountability and companionship meaningfully improve consistency with exactly this kind of practice. Make sure you are subscribed and have notifications turned on, because I have an upcoming video specifically on the connection between inner ear health and the broader vestibular system, walking through additional research on vestibular rehabilitation therapy that builds directly on what we covered today. That is a conversation I think many of you will find genuinely valuable, given how many balance-related questions come through the comments on this channel. If this video gave you something genuinely useful today, I would ask you to consider sharing it with someone you know who has been quietly dealing with this same issue, whether that is a parent, a spouse, a neighbor, or a friend. Balance problems are so often suffered in silence, dismissed by others or by the person themselves as simply a normal part of aging, and that one share could genuinely change how someone finally understands and addresses what their body has been trying to tell them. Before you go, I want to hear from you directly in the comments. Which of these 5 causes surprised you the most, and have you noticed your own balance changes, matching any of the specific patterns we discussed today, whether that is the positional trigger of BPPV, the low light difficulty tied to vision changes, or a timeline that lines up with a medication change? I read every comment personally, and this channel exists because of the honest conversations we have together in this space. Take care of yourself, and I will see you in the next video.